Begin with the commemoration of the World Maternal Mental Health Day, which is observed every 5th day of May. Now, the theme for this year's edition is Let's Invest, a Call to Action. The aim of the theme is to draw attention to essential mental health issues concerning mothers and families. Now, many organizations around the world are coming together to increase awareness and decrease the stigma surrounding perinatal mood and anxiety disorders. TVC News Celestina area takes a look at the challenges women face after birth and treatment options available to help women recover.
In many countries, as many as 1 in 5 new mothers experience some type of prenatal mood and anxiety disorder. These illnesses frequently go unnoticed and untreated, often with tragic and long-term consequences to both mother and child. Women of every culture, age, income level, and race can develop prenatal mood and anxiety disorders. Symptoms can appear anytime during pregnancy and the first 12 months after childbirth. Untreated prenatal mental illness is one of the leading causes of death for women during pregnancy and the first year after birth. This year's theme for the World Maternal Mental Health Day is Let's Invest, Call to Action for Investment and Equity in Maternal Mental Health Care. The theme highlights the need to invest in maternal mental health and emphasizes that investment should not be limited to financial donations, but includes investing time, expertise, or simply a reminder to invest in yourself. Life changes around pregnancy make women more vulnerable to mental illness. For instance, the negative cycle of poverty and mental illness can impact a woman's ability to function and thrive. Joy Akintiyede, a midwife at Kuje General Hospital, stresses the need for pregnant women to attend antenatal programs. She explains that in the course of the programs, expectant mothers are counseled on expectations after childbirth and how to handle some situations.
The woman has to be empowered again, counseled, reminded what those things we have told her in antenatal clinic. She's being reminded. She knows what she should do for her baby. She is even being taught what she will hear from people at home. That's their traditional belief, all those religious beliefs. She now knows what to stand on.
As midwives, we advise that women start getting care from the time she notices that she is pregnant. It is expected that the woman should start attending the antenatal clinic where she will be examined, she will be counseled, and whatever issues she may have in mind, it will begin to be addressed.
To be treated with empathy, for them to access healthcare services, they are being judged or somehow even prosecuted. Especially some of them can, the illness can be severe enough that they can actually maybe kill their infants. That is infanticide. And before you know it, instead of being treated, they will be subjected to trial and all those things.
Providers and the general populace should be able to provide support to these women. So they need a lot of support and understanding because not only them, the entire family is affected when a woman undergoes this condition. So it is very important for the public.
The country representative of UNFPA assures that measures have been put in place to reduce maternal mortality and train nurses and midwives on how to attend to cases of maternal mental illness.
In some of the more northern states, we actually have a maternal mortality rate that is over 1,500. And we're working very closely at state level with the Commissioner of Health, who are very collaborative in order to bring that number down. But it is basically about access to safe deliveries, training nurses and midwives, and ensuring universal access to family planning.
A common maternal health problem is depression. It affects about 90% to 25% of women in the maternal periods. The majority of those affected are women in low and medium income countries, which is significantly higher than women residing in high-income countries. It is unevenly distributed across the world regions, and thus, low and medium-income countries contribute the least data due to the paucity of research. Mental health care provides the necessary support to empower women to identify resources and personal capabilities. These can enhance their resilience through difficult life circumstances and support them to nurture the child optimally. No health without mental health. Increasing awareness will help drive social change towards improving the quality of health care women who experience any form of PMED get, and also reducing stigmatization of maternal mental illness. Celestina Iria, TVC News, Abuja.